Let's talk about lens options for cataract surgery. For this, I think it's helpful to think about three different distances. One I would simply call distance vision, which is someone across the room to somebody who's really far away at a sporting event. And next we have intermediate vision, which would be your arm outstretched. That's your computer screen, dashboard of your car, food on your plate, alarm clock in the morning. And then we have our near vision, where you like to hold a book up close. So again, near, intermediate, and distance vision. Most patients with cataract surgery are going to aim for distance vision, knowing that makes them totally dependent on reading glasses up close, and they may or may not need glasses for distance depending on the measurements we get of the length and shape of the eye. The fork in the road question is whether glasses, and when I say glasses, you can substitute contact lens if that's your preference, but whether or not glasses bother you. If you've worn them your whole life and you're planning to wear them after surgery, you like the protection, they're not an inconvenience, then I would recommend going with the standard lens that insurance pays for, aiming for distance vision like I just mentioned. And it is an excellent lens. In fact, usually when we aim for distance with this lens, we actually pick up some intermediate vision usually as well, but you're still totally dependent on reading glasses up close. If, however, there's value in trying to minimize glasses dependence, then there's a few topics to discuss. And these are highly customizable. There's an important caveat at the beginning, which is that even if you spend extra money on some of these premium lens technologies, I cannot guarantee a surgical outcome, nor can any eye surgeon, primarily because of one factor we cannot control, which is exactly where that lens settles into your eye when it heals. If it sits quarter millimeter this way or that, it can affect your prescription. However, we've invested in some very advanced technologies to give you your best possible outcome. The three topics I'd like to discuss include a toric or astigmatism correcting lens. Next is a multifocal lens. And then lastly, we have monovision. So astigmatism is simply part of your glasses prescription. So if you don't correct it with a standard lens, then you're just going to have more blurriness after surgery that you would lean on glasses or contact lenses to correct. If you're a good candidate for this lens, then the toric lens will dramatically reduce, if not eliminate, that astigmatism to give you your best possible vision and more independence from glasses. The multifocal lens is a category of lens that is giving you more depth. So not just distance and some intermediate, but bringing you in a little bit closer. Many of these lenses not all use rings to do that. And so it's important to know that sometimes you can see some halos around lights. These almost always go away and minimize over time as your brain kind of adapts to the new technology. And it would be very unusual to have persistent issues with that over time. With a symphony lens, which is my lens of preference for the multifocals, if we aim for distance vision, we pick up intermediate arm's length vision well. And then in comparison to the standard lens, it would bring you in even a little bit further into what I'd call a social or functional near vision. Not quite getting you all the way to reading, although I do have patients who get out of their glasses entirely with this lens, but I'd want you to expect to still need some help up close, but it would bring you in a little closer, give you a little bit more independence than that standard lens. This brings us into the monovision discussion, which monovision in various forms involves offsetting one eye slightly from the other. So full monovision is actually when one eye is set for distance and the other eye is set all the way for near, and you give up your depth perception with this. I do not offer this to patients unless they know that they like it, and they've been doing this for a long time. Otherwise, I'm a fan of what's called mini monovision, where we offset. So the first eye we aim for distance, and the next eye we give up some distance vision, aiming for intermediate, knowing that we're going to pick up some reading with that eye as well. Everybody will tolerate this slight offset of distance intermediate. At the end of the day, you've still got a pair of glasses after surgery that make both eyes look great at all distances, and you may find that you don't need them at all or that you like to wear them more often, but it gives you a lot more independence. With a standard lens, the monovision does not cost anything extra. And then there's even a very subtle form of this with that symphony lens that I mentioned that I'd almost call a micro monovision, if we're going to offset that second eye just slightly to give us a little bit more reading if you didn't quite get what you were looking for with the first eye in terms of the up close vision. So again, we have monovision topic, multifocals, and toric lens. Lastly, I do want you to be aware that there is a trifocal lens that gives you all distances, distance, middle, and near out of one eye, but you take a hit to the quality of your vision in order to get that. And for that reason, I don't offer this lens, but if it's something that really interests you, I can get you to a colleague for further discussion. I appreciate the opportunity to care for you, and my surgery scheduler can also help you navigate questions around these topics. And if needed, we can have further discussion on the phone. Of course, I'll be the one making the ultimate decision about whether or not you're a candidate for any of these technologies, and know that I have your best interests at heart and commit to treating you like family as we navigate those decisions. I look forward to seeing you on your surgery.